Welcome everyone to our webinar, 20K in 15 Days, the playbook practices used to boost production fast. Today we have two amazing speakers with us, Dr. Shilpi and Mark Talis. Welcome, Dr. Shilpi. Welcome, Mark. Thank you for being here today. Dr. Shilpi is the Chief Dental Officer of the Dentist Entrepreneur Organization, DEO, which I'm sure everyone on this call has heard of. In this role, she partners with dental leaders and multi-location practices to elevate clinical performance and drive sustainable growth for practices across the United States. Welcome, Dr. Shilpi.
Thank you.
And Mark Talis is the Chief Operating Officer at Advanced Dental Center. Mark brings a sharp operational mind and a genuine passion for patient experience to his role as COO of Advanced Dental Center. He works alongside founder Dr. Rachel Talis, and Mark oversees the day-to-day operations across Advanced Dental Center's locations, ensuring every office runs really smoothly so the clinical team can focus on what they do best, which is taking care of patients. Welcome, Mark.
Thank you.
Before we get started, a few reminders. If you'd like to ask any questions, please put them in the chat box or in the Q&A section on the bottom of your screen. We'll have a couple minutes at the end of the session for Q&A, but if we don't get to your question, you can still put it in the chat, still put it in the Q&A, and we will follow up afterwards with responses from Dr. Shilpi and the team. So without any further ado, Dr. Shilpi, I will pass it on to you.
Thank you. Thank you, Abby. Welcome, everybody, and happy Tuesday. It's hard to take out 1 hour of time as dental professionals. So the next hour, we're going to keep it light, fun, entertaining, adventurous. So sit back, relax, and please allow me and Mark to share our experience and our journey with you. Open to share any knowledge that we have. Please post your questions and we will try our best to get to them. Mark, ready to get started?
Absolutely.
All righty. So we are talking about AI in healthcare today. And what I wanted to start sharing is the gap between actually having AI and using it well, and how much production the average practice leaves on the table. Most practices do not have a revenue problem. They have a standardization and system problem. The conversation around AI in the current world is very polarized. Some believe it can solve everything. It's a magical solution, while others are still skeptical of its abilities. The truth, honestly, in my opinion, is somewhere in the middle. The real power is in the balance. As doctors, as clinicians, AI can serve as a very strong anchor for us to build systems, standards, and accountability. So, what I wanted to speak about today is it's not about diagnosing more or selling more. It's about missing less disease, catching things earlier, improving patient outcomes, being proactive. So, the human eye detection is influenced by many, many things: luminescence of the monitors, quality of the exposure, when you interrupted while analyzing the X-ray. Did we just miss finishing up that one bite wing? Fatigue, time of the day, how the sun is hitting in the operatory. There are so many other things. But what AI does is it analyzes unbiased pixel by pixel that makes the largest impact. So today, we are trying to achieve a way to standardize our treatment plans, eliminate bias, decrease decision-making fatigue, and really, really get good at honest treatment plans. Revenue and production is a byproduct and a great one, I must say. So, quantify this with me at a very high level. Missing 1 to 2 surfaces of decay per patient across 10 to 30 patients a day, every day, every provider, every hygienist. That leads to thousands per day and hundreds of thousands per year. Switch this to analyze it from a patient's perspective. I call it the cost of delay to damage curve. Incipient decay, fluoride, monitoring, education, curodont, small lesion, filling, larger lesion, crowns or root canals, further delay, extractions, implants. Same tooth, same patient, different time zones, and a completely different financial burden. The cost to the practice is loss of patient's trust. Mark, as a COO to your organization, what made you realize there was an opportunity to be even more strategic about how your practice was using Overjet?
Yeah, knowing what I know now, I kind of hate admitting this, but we had Overjet in our practice for about 2.5 years. And for most of that time, it was really an afterthought. So some of our doctors were using it occasionally, some didn't use it at all. When it did get used, it was only getting used to, pull up an x-ray, show the patient, hey, here's the decay. It was almost like a instant second opinion, so to say, as a confirmation of what the patient or what the provider was saying was what it was. But there was no consistency. We didn't have any protocols. We didn't have a standardized workflow. We didn't have any accountability around any of it. So if the patient actually got the benefit of Overjet really depended on which provider they were seeing and how busy was the schedule that day. If they're running behind, they're probably not going to use it. If it's a slow day, maybe they will, or maybe they're not in the mood. Then we really started looking at the numbers, and we realized that we were missing restorative and perio opportunities every day, not once or twice a week, but every day consistently we were missing these opportunities. And that's when we kind of realized, hey, you know what, having this technology isn't really the same as using the technology, and we need to have a protocol so we can really get the full benefit out of it if we're paying for it.
Mark, you bring out a very strong point here. Having the technology is not really same as using it. In the next 45-ish minutes, Mark and I would be talking about all about instilling protocols, simple, standardized systems that is repeatable. I get this question asked a lot. What is the most common underutilization mistakes that a practice does? Let me say something that might feel a few people uncomfortable. AI and technology is not underperforming in your practice. It is the lack of systems that is underperforming. Because I'm yet to walk into a practice where technology was the problem. This is where I integrate the technology. The difference between implementation and integration, exactly what Mark just mentioned. If you already have Overjet in your practice, congratulations. You're ahead a lot of people. But I really want everybody to take a moment and honestly ask yourself this question. Feel free to drop it in the chat. You have implemented it, but have you truly integrated it? Can I come to your office and ask a simple question to any team member? Hey, explain me the colors. Would they be able to answer it? The walk from implementation to integration is a very important one. It's actually a very short walk. It just can take us only a couple of weeks, but it's the foundation of success. Let's imagine the clinical patient journey with me for a minute. I'm talking about only the clinical parts of the patient journey. If I simplify this, I can break the journey in 4 steps. Diagnosis of the patient's needs, comprehensive treatment planning, case acceptance, and delivery of care. Overjet has the ability to impact the first 3 stages of this journey, but only if you have a clear, repeatable, and efficient system that involves every team member in the practice. Level 1, lack of clarity in diagnosis. Before we even get to treatment planning, let's pause and ask, have we standardized how we diagnose? What happens is doctors jump directly to treatment planning. This is a class 1. This is a class 2. Let's monitor this. Let's leave it alone. Let's treat it. But what we skip is the most important step. Do they have clarity in diagnosis? Is this enamel decay? Has this reached the dentine? Has it crossed the DEJ? What is the appropriate clinical response in this situation? What is the caries risk of the patient? What is the decayed, missing, or filled number for this particular tooth? Could the mouth be worse than the X-ray? What are the different X-rays I need to be looking to confirm my finding? Just jumping into the treatment is visibility without clarity to action. Very frequently happens in hygiene too. Your hygienists quickly move to it's a prophy or it's an SRP, but do they have true clarity on staging, grading, diagnosis accuracy, and identifying the disease indicators, including systemic influence? In here, Overjet really helps quantify the radiographic disease indicators in colors, which is a reassuring step towards standardization of diagnosis. Level 2 in your patient journey, treatment planning without accountability. If your providers are treatment planning without accountability for conversion, that is a big area of underutilization. This is where I introduce the mandatory AI patient experience protocol. AI must be used in comprehensive treatment planning and treatment presentation and communication to the patients. If it is not used in both these steps, you are not getting the full impact of the product. So let's take a real life example. Mark, if you go to SeaWorld and you buy the dolphin experience ticket, you get to take a picture and you get to pet the dolphins. But is it fair that for some patients they get the both, but for the others they only get a chance to take a picture?
No, I want to pet the dolphin.
Right. So just because the provider is tired, just because the team is short-handed for the day, some patients miss on the complete experience. Every patient should receive the same level of clarity and presentation. Level 3, lack of team integration. Overjet is not a doctor tool. It's a team tool. Every member of the team should be able to communicate what the colors mean, what the findings represent, what are the next steps. At their own level, of course, but they have to be mini AI enthusiasts. When the entire team is communicating consistently, there's repetition of information, patients hearing the same message multiple times, understanding improves, and trust increases. That's most important. So if you, as the doctor, is the only person in your office that is using Overjet, you are underutilizing it. Okay, level 4. Underutilization of the clinical dashboard. If you guys use the clinical dashboard, you know it's the gateway to operational excellence. But if you don't, you are in for a treat. And we have a little slide where we will talk more about it. Lack of utilization of the clinical dashboard can lead to multiple areas of opportunity in your office. It's a powerful tool that helps you organize your day, identify patient care opportunities, assign roles and responsibilities, decrease burnout, improve team efficiency. It's like your vacation itinerary, guys. When done right, feels like a true vacation. If not, your days can be chaotic. So, to summarize, Overjet does bring clarity, but your team is the one that brings the clarity to life. Mark, from a business perspective, what was the upside you weren't fully capturing yet?
Yeah, look, it's difficult to transition from being elbow deep in a root canal to, going in and having to do an exam. So on the restorative side, we had decay being flagged that maybe our providers weren't prioritizing in their treatment conversations. On the hygiene side, we had perio findings that probably should have been driving a different level of care. But because we didn't have this consistent process, patients may have been staying on a standard prophy schedule when maybe they needed a localized SRP. And then when we really added it all up, all the missed restorative, the missed perio, day after day, week after week, across all the locations, we were really leaving a substantial amount on the table. And forget about the revenue, that's part of it. But from a patient care, perspective, we were missing patient care opportunities. And we've got, these patients come to see us and they trust us to take care of them and to catch everything. And maybe they were walking out the door with not fully understanding what's going on in their mouth. And maybe there was some disease that was under communicated.
That's right, Mark. Thank you for bringing this up again, that production was really a byproduct of everything. It was all about doing honest and efficient clinical dentistry. Mark, can you share a real example from your practice for us from before you had a strategy in place?
Yeah, I mean, like I said in the beginning, we had Overjet for 2.5 years and we probably weren't using it the way we need to. So I've got more examples than I can count. But, typical day, patient comes in, x-rays are taken, Overjet's running its analysis and flagging findings. Maybe it got some early decay or some bone loss. And then we kind of hit a fork in the road. And it really, what happened next depended on who that patient was seeing and who the provider was. So one of our providers, we had a provider who was really gung-ho on all the tech, and they might pull up the Overjet screen and show the patient the highlighted areas and really use it to have a meaningful conversation. And by meaningful, I mean the patient leaves really understanding what's going on in their mouth. And then the provider in the next operatory over, they might glance at the findings and move on. And it's not because maybe they disagreed with the findings, but it just wasn't part of their routine. Or they might not glance at them at all, like I said, if they were running behind. So it was super inconsistent on what was happening to our patients in the offices. And, meanwhile, the hygienists, they also didn't have a protocol for using Overjet in their appointments. And the assistants had no idea what findings were being flagged, because if we were pulling up Overjet, it was in the associate's office on their computer, and nobody else was really looking at it. So we didn't have consistent reinforcing messages along the patient journey, right? And I think you mentioned that that's what you call implementation without integration. So we had this technology installed on our servers, but we didn't have a system around it. And it was really costing us in production and in patient care every day.
Thank you, Mark. This was the stage when Mark and I partnered along with Dr. Talis to create systems in the organization. We spoke about how there could be a gap. We spoke about the most important common underutilization mistakes and areas. But the question that we get asked a lot is, where do we start? How do we start the process? So the first thing that's necessary that needs to be done is to do the AI audit. My clinical audit framework is basically divided in 3 steps. When I do this audit, I'm really trying to establish patterns and trends. What the team is really good at, it's really important for you to know so you can tell them, great job. Kudos. Keep doing what you're doing. And we also need to know where we need to get better. I do my audit in three parts: clinical audit, KPI analysis, provider proficiency, and leadership. The clinical audit is where I start. We utilize the Overjet platform, audit clinical charts, review data, and you're looking at new patient exams, recall patients. I dig deeper, enterprise analytics, individual provider patterns and trends in treatment planning. I like to correlate successful clinical days with Overjet findings on those days, just like how Mark said. Who was the provider on that day? Who was the DA on that day? Are they more excited and proficient, and that's the reason we had a good outcome on that day? Is a single provider trending better than the others? Are there differences across providers? Do you have a treatment coordinator who uses Overjet more in explaining to patients as compared to someone else? This gives us a clear picture of utilization, team's understanding of platform's capacity, the insight into clinical strengths of providers and hygienists. Then we move into the KPI analysis. This is a second audit, or the second level of the audit, where I do a deep dive into the last 6 months of financial performance, which is clinical oriented. Monthly revenue, daily average, care per visit. This is a KPI which is a favorite one in a lot of organizations and yet unknown for a few. What this basically means is the total revenue for the month divided by the total appointments seen by the provider in that month. That includes new patient exams, recall exams, suture removals, limited exams, treatments, crown deliveries, lab appointments, everything. What is the average dollar number that was produced per appointment? This gives us a lot of information about the office structure and the clinical and the operational strength of the office. And that could be a discussion for a different day. But if you are utilizing Overjet in all the pit stops of the patient journey, I would like to see the care per visit start going up. If possible, I would want to see the number of new patients seen by the provider, average revenue per new patient, and average new patient accepting treatment irrespective of the dollar amount. So the warm bodies, the number of patients purely who stayed back for treatment, irrespective of the dollar amount accepted. This is direct provider accountability. Performance of hygienists under each provider. This is provider leadership. This helped me understand and identify trends over time, understand performance patterns, and see where the opportunity exists. The third level of audit is a very important one, more qualitative than quantitative. Do you understand the colors? Is what I get together with the providers in a peer-to-peer format and understand their competencies. So we meet with the doctors, try to understand where they stand. What is your workflow, doctor? How do you navigate the dashboard? Do you know how to turn on and off the findings? Do you have an SOP for what should be done daily? Why is this important? Allows me to understand their comfort level, identify gaps, elevate their enthusiasm and buy in for the platform, customize the mentorship program. So, in one sentence, if I have to summarize this, observation leading to pattern recognition, leading to customized strategy for the office. So, the aim is not to apply a generic solution, but build something that really works for the practice. Mark, What was it like going through all the audit process and what did it reveal about your practice?
Yeah, going into the audit, I definitely knew, we had some room for improvement. I don't think I fully understood the scope of that improvement until you were able to put that data in front of us. What made the process so powerful was that you didn't just ask, hey, are you using Overjet? You really dug into how we were using it, and provider by provider, appointment type by appointment type. You were able to pull the clinical charts, and then you correlated them with the Overjet findings against the actual treatment plans in the charts, and then layered in our financial KPIs, and that combination really exposed a pattern that I couldn't see looking at things individually, right? And what we found was there was a huge variation between our providers. Some were occasionally referencing the findings, and others were had basically opted out of using the tech altogether. And what we found was our best production days were directly correlated with the days where Overjet findings were being used and being presented and discussed with the patients. And, same thing in hygiene. We saw perio findings that were being flagged consistently by the AI, but rarely translating into the appropriate level of care. And the audit really turned 2.5 years of gut feelings into something that was quantifiable and measurable, so that we could act on it. And this was probably, for the first time, we could really identify where these breakdowns were happening, what's it costing us. And then we were able to build a protocol and a targeted strategy instead of, you can tell them, hey, use Overjet until you're blue in the face, but it's not going to happen unless there's a strategy behind it. And the other thing that was really great, once we had that clarity and those metrics, I was really able to get my office managers buy-in on this as well. I think it'd be great, Dr. Shilpi, if you want to review our audit results with them.
Yes, absolutely. So, Abby, can we move on to the slide with the audit results? This is enterprise analytics. Abby, if we want to quickly go back, for everybody who is yet unaware of this super cool feature on your Overjet platform, when you log in, you can click onto this. And this basically gives you a snapshot of the total treatment percentage in the office as compared to the recommended AI findings, along with the treatment acceptance and case acceptance. The cool part about this is you can actually toggle between individual providers, between individual time periods, and you can start establishing patterns and trends of treatment planning and identify missed care opportunities. I do this for myself too. Every couple months, I go back and I check what is it that I have been doing as a habit, and is that the right thing to do, or do I need to tweak myself to be a better clinician? Thank you, Abby, for that. So let's talk about the provider audit results. To be respectful, we did a slight tweak to the names of the providers. So Mark's providers were Dr. Minnie and Dr. Mickey, and our hygienist was Pluto. This was the initial KPI data that we collected. Doctor net production, doctor collections, the care per visit, and the daily average of the doctor. This is for Dr. Minnie. The next slide would show you similar amount of data collection for Dr. Mickey. And then everything was tied into the overall office results or the audit results before we initiated the training. You need to benchmark. You need to understand where you are. If not, you cannot quantify if the needle has been moving in the right direction. If you look into the hygienist, Mark's hygienist was very well performing to from the get-go. However, there was still room for improvement in clinical efficiency. Abby, what is our next slide? Oh, perfect. Yes, this is what I was looking for. So based on the data that we collected and analyzed, we set a goal of Dr. Mickey 4,700 daily average would be a goal that we would like to chase and would consider it to be successful. Dr. Minnie, $3,000 daily average, and hygienist Pluto, $2,000 daily average. This was the goal that we set. Not only were we trying to establish improvement in diagnosis, improvement in patient communication, improvement in the team's proficiency of using the platform, but we were also trying to establish consistency. That was the biggest win for us, which we would discuss in a bit. Thank you, Abby. For everybody on the call, just remember those numbers, 4,700, 3,000, and 2,000. Okay. So now that we have the audit results, we had to get the team bought in. There were issues of skepticism. How would you introduce Overjet to the front desk, to the hygienist, to the teams, right? So the key over here is simple stuff. No technical jargon. Making your team feel special for having this technology. Inviting their family to experience this amazing technology. Free exam for your family. Go ahead and invite your team's family members to see what an amazing job they are doing and how advanced they are in the world of AI. And this is when I address decision-making fatigue. So, Mark, I'm going to call Abby on for being my volunteer because you know the answers to the questions I'm going to ask you. Abby, would you be my volunteer for a fun activity?
Of course.
Okay. Abby, who do you have at home?
I have my husband Colin.
Okay, all righty. So Abby, it's a Tuesday evening and you come home, you're exhausted, and your husband says, Colin says, Abby, let's go out for dinner. What would be your first initial response?
Maybe it's midweek. I'm a little tired.
Yeah, okay. My clinician's on the call. Is that relatable? You go home and your spouse says, let's go out for dinner. On a Tuesday night, your initial reaction is, no, honey, I'm tired. But then your spouse says, it's Valentine's Day. Let's celebrate. And Abby says, okay, all right, let's go. Now Colin says, where do you want to go? Do you want to go to a Thai place? Do you want to go to an Italian place? Abby, what would you say at that time?
I would say whatever you want to pick. I'd leave it up to him.
Right. No more decisions. Let's just go somewhere. So Abby, let's imagine that you and Colin, you land up at a Thai place. And now your spouse says, honey, what do you want? Red curry, yellow curry, broccoli, tofu. And Abby says, any curry, let's just get food. But fast forward this to a Saturday or a Sunday morning. You are well rested. And the same thing to all my doctors and healthcare providers on the call. The same question is asked to you again. What would be your answer this time, Abby?
I'd be much more excited to go out to dinner on a Saturday.
Yes, that's right. Why does that happen? Because during the day, we face something called decision-making fatigue. It's tiring. For all the clinicians, we don't realize that when you are doing an exam, when you are talking to patients, you are taking about 200 to 400 micro mini decisions per appointment. When you are looking into an X-ray, you are evaluating those X-rays in a two-step decision process. Hey, do I see a change in the grayscale? And if I do, should I act on it or is it normal? Now imagine we take away 50% of that fatigue. Do I detect a change in the grayscale? Somebody is already doing it for you. Now, what you do is only the decision making of should I act on it or not. This is the true power of AI-backed X-ray analysis. And when I explain it to the teams, this is where they lean in. I tell them, this is not replacing you guys. This is your AI assistant. It's highlighting. You decide. We then move to simplify it with colors. Red, yellow, orange, disease or concern. Green, healthy. Blue, existing work. This is also when I get asked about false negatives. Dr. Shilpi, the Overjet platform is picking up so many false negatives. And this is where I introduce my next fun story. Imagine you bought a big box of implant parts and RCT files and composite capsules. You come home and your toddler drops it all on the floor. Now you take a deep breath and then you say, help me pick up everything from the floor, buddy. At that moment, are you expecting your toddler to decide between the RCT files and the Lego block? No. You are just expecting him to pick up everything from the floor. Compare this to your AI assistant who is picking up everything from the X-ray that has the slightest deviation in the grayscale. You decide which is the implant part and which is the Lego. You decide which is a cavity and which is just an artifact. That is your AI assistant. You are not missing anything this way, and you as the clinician is the final decision-making individual. So I teach the false positives versus high sensitivity in picking up changes in radiographic data. That's the shift. You're not replacing judgment. You are supporting it, but this time it's consistent and objective every single time. Mark, how did you approach building the strategy around Overjet that got the whole team aligned?
Yeah, well, we knew what didn't work, right? So, just having it available and hoping people would use it and utilize it, that didn't work. During our manager meetings, reminding them, hey, make sure you're talking about this in the morning meetings. And they're reminding everyone, hey, make sure you're pulling up Overjet. That didn't change, and it wasn't going to change people's behaviors because we didn't have a system behind it. So we knew we had to get very, very intentional on this. And that really started with leadership alignment. So myself, our clinical director, and the office managers, we all had to be on the same page about what we were doing and why. And we had to stop thinking of Overjet as just an optional doctor tool and really start thinking of it as a patient experience tool. And then we rolled it out role by role. So every team member had a very specific, clear responsibility that they knew they were responsible for. Our hygienists, we train them on how to reference the findings during their appointments. Our assistants, we train them on how to set those expectations with the patients if they've got questions. Treatment coordinators, we train them on how to use the visuals in Overjet during the case presentations. And what that really ensured, and what we really needed to ensure, was that we had this consistent messaging from all clinical staff along the entire patient journey. And the key was to make it simple and make it mandatory and make sure it's being done the same way every time, every patient. So we created pretty straightforward scripts where people could deviate a little bit left and right. And we really standardized the workflow, and the other part was making sure we reinforce that on a daily basis. And after 2.5 years of it consistency, I needed and the team needed to see that this was something different. No, this isn't a suggestion, but this is how we operate. And I think once they saw that it was actually making their job easier and it was making our patients healthier, that buy-in really followed naturally.
Thank you, Mark. You bring in something very important. It was necessary to tell the team that this is where our organization is headed to, and this is expected to be a mandatory protocol in our patient's experience, designed to make your patient's experience better and also help them decrease burnout. Mark, how did your team's attitude shift once they saw that the strategy was amazing and working?
Yeah, I mean, the shift didn't happen day one, minute one. Like I said, for 2.5 years, Overjet had just been this thing that kind of sat in the background. And some people used it. Honestly, most people probably just ignored it. And nobody really saw it as an essential tool every day, every patient, but as an optional thing. So when we really came in with the structured strategy, there was definitely a lot of skepticism. And I'm one of those people that loves to try out tech. So there was, all of my teams, they've been through plenty of let's call them new initiatives before. But I think in this case, the results are really the best convincers. Within the first couple weeks, I had hygienists messaging me on Teams, and they were super excited because that patient finally said yes to treatment that they'd been declining for multiple visits beforehand. And the difference really was the patient was able to really see and understand what the hygienist had been telling them that whole time. And then I had docs who, barely touched Overjet before, they started using it every exam because they just saw how much smoother their exams went and their treatment acceptance and case presentation was. I think there was a shift. It was like a night and day shift when the team really stopped seeing Overjet as something that leadership and I myself were pushing on them. And they really started seeing it as a tool that made their day-to-day life easier in the office. And I actually had doctors when I check in with them, who they never really used Overjet for the previous 2+ years. And they were telling me, I can't imagine going back to doing exams without it. And when that shift occurred, that's when we really saw a big jump in our productions and patient care.
That's right, Mark. And everybody needs reassurance and validation. The data in the room for the patient and for the doctor is this third person entity that's unbiased. It helps both your providers and your patients to trust, build the empathetic relationship, and move confidently towards what can I do to take care of my health. So, what Mark and I just described was analyzing the areas of underutilization in the office, doing a thorough audit to quantify those areas, and then creating a customized, tailored mentorship plan, which was initiated, executed, and this is the walk from implementation to integration. During this process, we made sure that the teams knew that we were available on a daily basis. Dr. Talis, who is the clinical director of the organization, was always available for her hygienists and providers. And we started seeing the needle move in the positive direction as early as in 2 weeks. So the greatest win for us was just not an immediate spike in the KPIs. The greatest win was consistency. It's the moment when I know that technology, the comfort around it, the concepts, and most importantly, the trust, they have truly become a part of the clinical DNA. Because once it reaches that level, the results are no longer forced, it's predictable. So my prescription is super simple: consistent support through the initial implementation and sustained guidance for the next 3 months. That's where the real magic happens. So, Mark, I am going to hand the floor over to you. Please walk us through the specific numbers. What moved and over what time frame initially?
Yeah. And I'm gonna cut Dr. Mickey a little bit of slack because were they were fighting through the flu, if I remember correctly.
Yes, that's right.
But yeah, when we actually looked at the specific numbers, to be honest with you, it kind of upset me, because it really put into perspective how much we were missing for 2.5 years and we were leaving on the table. So within the first 2 weeks of implementing this controlled strategy where everyone's on the same page, we picked up over $20,000 in net production. And nothing else changed. This was just entirely from utilizing the tech that we had, from utilizing Overjet the way that we should have been. Case acceptance was the first metric that we really saw tick up. When patients could see the Overjet findings on the screen and every team member along their visit was reinforcing the same messages, we saw that the patients were saying yes at a significantly higher rate. Restorative obviously saw the most dramatic lift, I think, but we also saw really great increases on the hygiene side. Perio diagnosis became more consistent and better communicated. Like I said, this kind of upsets me because this production was always there. All of this was always there. We just weren't capturing it. The tech didn't change. It's just the system around it and how we utilized it. That's what changed. And because we built the standardized, repeatable process, those gains weren't just a little blip on the radar, but we were able to see them consistently and they compounded week over week. And then we were able to take what we learned and implement it at our other locations.
That's right, Mark. And Dr. Mickey quickly gained speed, which we realized within the next few weeks, and the entire office was performing at a much higher efficiency and at a lower clinical burnout. Mark, what changed about how your team presents findings that impacted case acceptance?
Yeah, so before it was mostly, like I mentioned earlier, a visual aid or a quick second opinion. So the doc might pull it up and say, hey, you see that highlighted area? That's where the decay is. It was helpful. So we still, saw some benefits from that, but it was very passive. And again, it only happened depending on the mood of the provider or, how busy their schedule was. After we standardized our approach, that same conversation became a lot more powerful. So it turned into something like, let me show you what disease I see on your x-rays. Hey, you can see this highlighted area right here. That's decay that's already moved past the enamel into the deeper areas or the deeper layers of the tooth. Right now, we can address it just with a filling, but if we wait, this might turn into a root canal or, in a crown. If you keep waiting, you might lose the tooth, and we're having conversations about implants. One of the tools that we really love in Overjet, and I can't 100% remember the name of it, but it basically shows you a side by side, so you can compare the disease progression. So we started using that for our patients, and we said, hey, look at this side by side from your previous visit. Can you see how it's already progressed? Can you imagine what it's going to be if we keep putting this off for another 6 months or who knows how long? And that really changed the conversation. So, now the conversation is visual, and with that side by side, they understand the urgency. And because the patient really understands what's going on in their mouth, it empowers them to make a true informed decision. Because you can't make an informed decision if you only have half the information. And now, because every team member was also on the same page and they were reinforcing that same message at all the different touch points, what we found that when the patient heard consistent messaging throughout their visit, that repetition builds trust. And then when you have that trust, it drives treatment acceptance. So really the difference between our old approach and the new one would be the difference between showing someone a picture versus telling the story.
Right, Mark, coming at the level of the patient to help them understand. Mark, what you're mentioning is the presentation tool.
Yes. Yes. It's
where
great.
you
I love it.
your x-rays can be put side by side over a time frame to show the progression of the disease.
Yes.
Mark, what was Overjet making visible in hygiene that was being missed before?
Yeah. So, it was detecting bone loss levels and calculus that supported, let's say, localized SRP, or a different level of care that maybe wasn't being recommended. So the AI Overjet was flagging it, but we didn't really have a good standardized process for our employees to act on it. So, like I said, maybe we had a patient who met the clinical criteria for a localized SRP, but they were staying on a standard prophy schedule. And it wasn't because our hygienists didn't care, but it was because without the visuals and the protocol, maybe the hygienist didn't feel confident making that case to the patient. And they didn't realize that the AI already picked up and identified the evidence that they needed to make that case to the patient. Once we really train the hygienist to use the visuals in Overjet in their patient conversations, so showing the actual bone levels, and they color code them, red, yellow, green, and then pointing out areas of concern on the screen. It puts boxes around the calculus. Everything really changed. So the patients understood why the recommended treatment was different. And the conversation kind of went from, hey, we think you need a deep cleaning, to, hey, let me show you exactly what we're seeing and why this matters for your health. And that shift really made a difference in the care we were providing for our patients, the patient's trust. You get that confidence. And obviously, from an operations side, I was happy to see a production boost as well.
Mark, I'm going to give you a black belt in Overjet colors. Great job.
Well, thank you.
Mark, I'm sure this is something everybody is thinking. What was the thing that actually really made the results stick?
Yeah, that was something that I spent some time, figuring out. We saw the results, so how do we make them permanent? Um, Two things I think really made it stick for the team, and that's daily accountability
Right.
and daily celebration. So we started tracking the metrics every day instead of monthly. So we were much more proactive instead of reactive. A lot of things change, from one month to another. And that allowed us to really see in almost real time which providers were presenting findings. And and when you measure something consistently, people are going to naturally perform better when they know you're looking at it, and you bring it up. It really helps you avoid some, let's say, difficult conversations that you think maybe you need to have. They kind of fix it on their own. And then the celebration piece was, I think, just as important, if not more important. So we made it a point every morning huddle. The office managers, they called out specific wins, whether it was a hygienist who had a breakthrough perio conversation, that finally that patient who we've been recommending treatment to and they kept saying no, now they said yes. Or, a doctor who had fantastic treatment acceptance the day before. Or, they were walking through the office and they heard an assistant who was really reinforcing the treatment plan and staying on that messaging. Those small moments of recognition really created a lot of momentum in the offices, and it made the team feel proud of the changes. And like you mentioned, I think that's a journey from having a protocol to having a system to then that system becoming a habit. And Dr. Talis and I were very, very intentional about being present during those first couple weeks. So we were walking the floors, we were coaching in the moment, not weeks later. We were showing the team that we're invested and we want to see this succeed. And once it became a habit, the results really took care of themselves. So the difference between, the first 2+ years and now is now Overjet isn't something that we ever have to remind people to use. It's just a daily habit. And they see that it makes their life easier. So they want to use it.
Mark, consistency is the key, and your hands-on support along with Dr. Talis's availability in supporting, coaching, and mentoring the providers was a crucial step in completely establishing the systems. And once the team started seeing the wins, the role was repetition and continual clinical calibration. I briefly touched on this earlier, but I want to take a minute to explain the mandatory AI patient experience protocol. AI has to be used during comprehensive treatment planning, coming up with honest treatment plans. Research indicates that 40% of decay often go undiagnosed. But what's more scary is about 20% of the diagnosed caries were incorrect. So mandatory usage for coming up with honest treatment plans and mandatory usage in treatment presentation and communication. The trainings that we had were divided into 2 to 3 sessions. The first session was platform confidence and buy-in. This was focused on teaching the team how to navigate the platform confidently, create enthusiasm, buy-in, and making them very comfortable using simple buttons to click. This was no different than hitting buttons on Instagram, Facebook, or TikTok. The goal was to simplify the platform for them to help them integrate in their daily workflow. And the second and the third and the continual sessions were clinical integration. These were around patient cases, standardization of diagnosis, treatment planning, patient presentation and holding the doctors accountable, hygiene calibration, scripts to help deliver the message and navigate conversations with patients. Now the shift was moved from what to say to how to say positively and empathetically. And this saw a huge shift from the first few weeks. Mark and Dr. Talis, they have done a great job in rendering the daily support to the doctors, celebrating the wins, highlighting efficiencies in workflow. So just like how Mark said, first we established the protocols, we created the systems around it, and we worked very, very hard in establishing this as a natural habit. We helped the team move from a new protocol to a system and something embedded in their muscle memory. Eventually, it becomes a part of the DNA. So when they start seeing the wins, they start understanding how this is making them a better clinician. Mark, how was your team's confidence in presenting Overjet findings that changed the way patients respond?
I mean, honestly, the confidence shift has just been amazing to see, and it's across the board with our clinical staff. And we had this tool, but the team didn't have any training or really an understanding of how to present the findings with conviction. And there's a real difference between knowing something's on the screen and then versus confidently walking a patient through what it means for their health. So now our team presents findings without second guessing. They're not wondering, are they being too pushy? Or are they maybe seeing things that aren't there? They can point to the screen and say, hey, this is what's going on, and here's what it means to you. And I honestly think that patients pick up on that confidence. A huge confidence boost. We've got some associates that are new grads, and they come out of school not the most confident. And that really, really helped bring their confidence up very quickly. And when your doctor and your hygienist are both speaking clearly and consistently about what they see, going back to patient trust, the patients trust the recommendation because they see that consistency and they have that clarity. And they don't feel like they're being sold. They're being informed. And they can see it with their own eyes. We're just guiding them through that story. The confidence really builds on itself. So when the team sees, hey, these patients are responding positively and they're accepting the treatment, now it builds on their confidence for their next presentation. It's like this positive feedback loop. And for the providers who barely touched Overjet for the 2+ years prior, they're honestly our strongest advocates because they've experienced what it was before, and now they've experienced what it feels like to have a patient that actually really understands what you're telling them and your diagnosis. And they're the ones that are telling me I'm never going back.
Right? Mark, let me ask you something interesting. If you could give one piece of advice to a practice owner who has Overjet but hasn't fully built a strategy around it yet, what would you tell them?
Yeah, so it might seem like a daunting task or something like that, but it's not like we started this years ago. We started, you're exactly where we were 2 months ago. We had Overjet for 2.5 years, and we didn't really use it the way we should have for that entire time. So I think the biggest takeaway would just be stop treating Overjet as like a extra or a nice to have, and really start baking it in to an every patient, every day. This needs to happen. This is how we operate. Uh, Whether you use it or not, the technology, if you have Overjet, it's already doing its job. It's already flagging, restorative and perio or hygiene, findings. You just need to develop and implement the protocols. And then the big thing for us was really training our team so that they understood what they're seeing, and then hold them accountable. Hold them accountable to turn those findings into actual conversations with patients. It's not something that they're looking at in their office or in the break room or some computer and sterilization. It's an actual conversation that they're having with the patients on those findings. So, very simply, if you want to do a little exercise, buy your team lunch and get them in the room and ask them to be very honest and ask them the question, hey, does every one of our patients in our practice across the board, regardless of who they see, do they receive the same level of clarity and communication around their oral health, irrelevant of who they're seeing or what day of the week it is or how busy we are? And, if the answer is no, then there you go. There's your answer. Again, I want to emphasize this. It doesn't take years or months to, see an improvement. We saw 20,000 in like 2 weeks. But the difference is you really have to use it.
Right. You just have to use it consistently and efficiently. So, if you guys are not leaning on AI, it is time. Here is what I would love for every office to do differently starting tomorrow. Explore your options that help you establish systems in office. Standardize, reduce inconsistencies. Diagnosis and treatment planning should be consistent to every provider, every patient, every time within the range of dental practice. Use AI as your anchor leading to your answer. Reduce decision-making fatigue with systems like Overjet. Diagnose comprehensively and honestly always, and commit to a 90 days of consistency. Mark's team could just get it in 15 days, and the walk is a short one, I can assure you. But 90 days of consistent support will now move this to the real clinical DNA of your team. Thank you, Abby, for allowing us to share our experience.
Awesome. Thank you so much, Dr. Shilpi, and thank you, Mark, for that conversation. That was amazing. So many good tidbits to take back if you're already an Overjet customer to get the most out of it. If you're not already an Overjet customer, I do have a QR code on the screen that you can scan to book a demo to learn a little bit more about the platform and hopefully take all this information that you learned from Dr. Shilpi and Mark to put it to good use. So thank you everyone for a great session. We do have, oh, I thought we had a question. We have a couple comments here saying thank you so much, Dr. Shilpi and Mark, for such a great conversation. So we will end it there. If there are any additional questions, you can reach out to Dr. Shilpi directly or Overjet. We'd be happy to answer them for you.
Thank you so much. Good night.
Good night.